Hi, this is Dr. Ash. As many of you know that I work as a consultant emergency and acute medicine in NHS UK, and I've been quite active socially on social media for quite some time. Recently, I published a post on Pakistan Medical Career Counselling and on other social media forum about my exam journeys, that how many exams I passed. So just to let you know that I passed more than 23 postgraduate kind of exam after my MBBS. It's not a post graduation qualification I'm talking about. I'm talking about post graduation exams. After MBBS, how many exams I did. So that post went quite viral, and there were so many comments about appreciation, and a lot of people liked it. There were few people who were thinking, is this guy confused, or why has he done so many exams? If he did PLAB, why did MRCS? If he has done MRCS, then why MRCP? If he hasn't done MRCP, then why FRCEM? So today I'm going to tell you why I did 23 post-graduation exams after my MBBS graduation. And in this video I will talk about why I did it. In my future videos I will talk about how I did it and what is the planning strategy, what is the method I use for study. So let's talk about why I did it. Was it a confusion, or was it poor guidance, or what? So let me start from my graduation. I graduated back in 2004, finished my house job in 2005. Of course, by May I was done with my house job. And while you're in Pakistan, the first thing you always do is, of course, you do the FCPS to secure yourself, isn't it? So I set up my three plans A, B, and C. My plan A was always to, do the USMLE, because everyone was talking about USMLE at that time, and so and the plan B was, in case if USMLE doesn't work, we'll go for PLAB route. And the plan C was, in case if nothing works, at least I am safe and secure in my own country, and I don't have to come back and do house job and go back to grassroots level again. So I prepared for FCPS, and within 1 month of my post graduation house job, I passed FCPS Part 1 in surgery. Let me be honest with you, I wasn't very passionate about surgery right from the beginning, but because in Pakistan there is so much of peer pressure, and everyone says, okay, surgeons, surgery is, if you are a surgeon, then you are a doctor, and those kind of thing. And there is always a kind of persona when you work with surgeons. You come across so many surgeons where you look at them and you say, oh, I want to be like them. But actually, from inside, I was not a surgeon. From my inside deep, I was a physician. And that was told to me by many of my senior colleagues. But I said, okay, no, well, I'm Pakistan, let's do surgery. I did FCP's Part 1 in surgery. Alongside of FCP's Part 1 surgery, you there's no harm in doing MRCS, isn't it? Everyone does it. So MRCS is a kind of small diploma which is equivalent to intermediate module. So when you're preparing for intermediate module, there's no harm in doing MRCS. That's what I did. So continued my training there and prepared for MRCS. And within the very first year of my post-graduation surgical training, I passed MRCS A and B, which was a kind of a pleasure as well as confidence. Then we started working on my plan A, which was already there, and I was working on USMLEs. I was studying day and night. I was working as a postgraduate trainee, and luckily we did USMLEs, me and my wife, in second year of my postgraduate training, which was like we did step 1 and step 2. Now it was a time to fly, isn't it, for step 2 CS? This is what I was thinking. And we went for all those process of visa application and all that. Somehow, because of my as my immediate supporter sponsor usually in visa application is your father, and my father died in 1994, so my visa application wasn't very well supported, so my visa got refused, despite that we score 250s and 247 in our USMLE, which at that time was around 99 percentile and 98. So at that time, that was counted as a very, very high score. Despite of that, my visa got refused, but I wasn't worried because my training was going on. I knew that even if I don't go anywhere, by the age of 28, I will be a surgeon in my own country anyway. So, anyway, plan A didn't work nicely, so that's fine, nothing to worry about. I was working on my plan B. Plan B was very simple, PLAB. So, if you have already done USMLE, PLAB is a piece of cake for you. If you've done FCPS Part 1, PLAB is a piece of cake for you. So, to be honest, it's nothing, nowhere even closer to the preparation you do for FCPS and USMLE. So, then we started preparing for IELTS. This was the so far FCPS, MRCS 1B, AB, and intermediate module, because with MRCS B we did intermediate module, and USMLE 1 and 2. So USMLE 1, 2, USMLE 1, 2, PLAB, MRCS 1, 2, FCPS 1, and intermediate modules. So 6 exams already done. That's within a period of 2 years of post-graduation. And then we started preparing for IELTS, which is a kind of 7th exam. I think this is the most toughest exam for me, because English was not my first language, so I had a big problem. So my first time score was the grade, second time I passed. So great means it's not that we were very, very poor. It was just with 0.5 marks in one of the component. But anyway, IELTS done. Now PLAB was nothing. We didn't even prepare for a single day for PLAB 1. We just went for exam and we passed. So this was the 8th exam. So PLAB 1 is done. Now it was the time to fly. Of course, we left for PLAB 2, 9th exam. Went for it, and by the grace of God, we passed it. And then we started working as a job. Now, few people ask me, why, if you are doing already MRCS A and B, why you didn't do MRCS C straight away? Well, MRCS C is not very easy. PLAB is comparatively easier, and it's better to do MRCS C while you are in the country, while you're already working there, you have enough money to do the courses and stuff. So PLAB 2 was easier for me, and I'm glad that I did that, because MRCS will assess you only for surgical thing, isn't it? But PLAB assesses you for psychiatry, gynae, and we had a proper study of everything. So PLAB 2 is a very, very good comprehensive preparation, which actually makes you a proper doctor. So having said that, we started working as a urology trainee doctor, and then started preparing for MRCS. When I came here in this country in 2008, 2009, I prepared for MRCS C, and I went for Royal College of London exam, did my MRCS theory, vivas, communication skill exam. So this was the 10th exam, maybe 9th or 10th exam. So this is how the journey continues. After 1.5 years of working in UK, I realized that surgery is not really what I want to do, because I got bored with bladder, prostate, and stones. So I was just forgetting my medicine. So, and I was academic throughout my life, 2001-2 onwards, I started teaching medical students. So losing grip on the medicine was not acceptable for me. So I decided to join emergency medicine. So I went for emergency medicine post in 2010. Now, of course, when you go to the emergency medicine, you can't just go and work like a service specialty doctor all your life. You have to pass exam to progress. So I started preparing for MRCEM and MRCEM. So during the first years of my training, I passed MRCEM A exam, MRCEM B exam. But because the love of medicine was always there, and I already did MRCS theories and MRCEM, so for me, MRCP was not really a big difficult exam, because with MLE's knowledge and with FCPS knowledge, for me MRCP was something which was easy to go. So I said, okay, well, I already have a knowledge. Why shouldn't I go for MRCP exam as well? All I have to do is book a date, go for exam, maybe prepare for 2.5 months. That's what I did. So alongside MRCEM A, B, C, I did MRCP 1, 2, PACES. So 6 exams collectively. So I think it's already 15 now from what I forgot the count. So which was a very good thing. So by 2014, I already did MRCEM plus MRCP. Now, a number of people ask, if you are doing USMLE, why you did PLAB and why you did MRCPs. Look, you always should have a follow-up plan, a plan A, B, and C. If you don't have plan A, B, and C, what if your plan A doesn't work? What if your plan B doesn't work? What if your plan C doesn't work? Things don't go straight away smoothly, isn't it? And I don't recommend people to stick to the same plan again and again, doing the same thing despite of continuous failure. You can always think of something else and you can move forward. This is my logic. Sometimes people say, no, just continue doing what you are doing. At someday you will end at the light. At the end of the tunnel there is always some light. But I believe in exploring new things straight away. If something doesn't work, start working on something new. Anyway, so this was after MRCEM. Of course, you have to do pass FRCEM. You can't be a consultant in emergency medicine without doing FRCEM. So then I started my journey for FRCEM. Now, with MRCEM knowledge, when you are already MRCEM, you have an opportunity to do European board exam. So it was not difficult for me because of the long journey and long academic hard work. I had to just book exam for fellow European board of emergency medicine part A and part B, and to be honest, I didn't study much for those exams. I just went, I passed. The reason I'm saying this because of my previous run-up. So the MRCP, USMLE, FCPS run-up was so long, I didn't have to prepare so much on these exams, European Board of Emergency Medicine Part A and Part B, which I passed in November 2016. So now, then FRCEM final itself has 4 or 5 components. So there were critical appraisal exam, there was SAQ exam, there was OSCE exam, there's SAQ, so and management viva. So there were 4 exams for FRCEM, and so now it's already around 20 exams now. For this journey, what I would say, MRCEM and FRCEM and FEBEM, they're all integrated, they're interconnected. So they're just parts, they're not nothing really new. I also wanted to do MRCP CH for pediatric because as an emergency consultant, you see a lot of pediatric, and we do see thousands of pediatric patients over a period of few years. So during my first job as an SHO, I saw 500 pediatric patients. So when you're seeing patients, when you're learning from them, why shouldn't you be doing the exam? So I did MRCP CH part 1 exam, and I wanted to do part 2 as well, but the time didn't permit me. At some point I will do, inshallah. So because you can then take a role of pediatric emergency medicine consultant as well as adult emergency medicine. So that's all about doing the exams. Now, do you still think it's a confusion? It's not a confusion, it's just a progression over one thing and another thing, and you are reaching the pinnacle of success over a period of time. And at some point after 5-10 years, you will have so much to contribute to the society, you can see patients safely. Now, still last year I was working as an emergency medicine consultant. Now, based on the MRCP, I thought, let's do acute medicine consultant job. Because after 10 years of emergency medicine, I thought I was not learning anything new, although it's an exciting specialty, but for me the learning curve was slightly getting flatter. So I decided to go to acute medicine. Now, nearly almost 10-11 months, or nearly a year now, I'm working as an emergency medicine, acute medicine consultant. When I went to acute medicine consultant, of course, with MRCP exam, you have a knowledge, but again, to prove to your colleagues to be a good consultant, you need to pass an acute medicine specialty certificate exam, which I did last year, and I passed. So that made me a standing in my colleagues, among my colleagues on my hospital now trust me that, okay, he has got this qualification and now he can see all medical patients. So what I'm saying that as a doctor, don't be scared of doing exams. You can do exams one after another, and this is purely not a confusion. This is a thirst to learn new things. So in short, I would say after my post-graduation, I did FCPS 1, intermediate module, MRCS A, B, C, MRCP 1, 2, PACES, MRCEM A, B, C, FRCEM, final 4 exams, and European Board 2 exams, and now Acute Medicine Specialty Certificate exam, MRCP CH Part 1. In my future, I'm planning to do Gastroenterology Specialty Certificate exam, which is going to be in April, and I'm planning to do a geriatrics exam because most of my patients are geriatrics. 70% of patients I see are elderly patients. A lot of patients I see are gastroenterology patients. So there's no harm in learning. There's no harm in moving forward. So this was all the reason behind why I did all this exam, and I recommend. Plus, I am an academic. I also want my audience to be bigger. I was a tutor for PLAB. I was a tutor for MRCP and MRCEM, FRCEM. So the more exams, more theoretical knowledge you have, more clinical exposure you have in different specialties, you can be a really, really good and safe doctor. As an emergency medicine consultant, if you have a knowledge of medicine, if you have a knowledge of surgery, if you have a knowledge of peds, you will be a good ED consultant. I hope this helps you, and in near future I will talk about how I did all this exam, what was my preparation strategy, and what was the what resources I used. Stay tuned, connected with me. Thank you very much, Dr. Ash from London.